This is SiriusXM Doctor Radio.
And now, from the heart of the NYU Langone Medical Center, this is Doctor Radio Coronavirus. What you need to know now. Here is your host, Dr. Marc Siegel.
A, how are we preparing? So let's start with your specialty. How are we preparing for this, and what is the actual risk, or is it changing all the time? How do we assess what the actual risk here is to America, and how are we preparing?
One of the interesting things that we did here at NYU Langone Health is that we started preparing about 2 months ago when we started hearing about this in China, and brought a group of really phenomenal individuals to the table to say, this is coming, and what are we going to do? And ran a number of different scenarios, talking through what would our emergency room look like? What would our inpatient side look like? What would we need in terms of staffing, equipment? So we had a little bit more time to think through these processes, which we honestly needed every second to be able to do that, because out of the gate, we suspected and we feared that this was going to be a major issue.
How does Bellevue figure into this? Because, I tend to be very focused in what I do, and I went out to Nebraska to the National Quarantine Center, and as I was leaving, they said, by the way, we have 2 partners in the United States. I said, who are they? He says, Emory and Bellevue. So I said, Bellevue, Washington? They said, no, Bellevue, where you are. I said, great. So how does that figure into your planning?
Yeah, so as you know, Bellevue, we share a lot of information with the leaders at Bellevue. We work very, very closely. And as you know, for a number of years now, what they've done is built this incredible, space that would allow for individuals to focus on these patients in a safe manner. So, really making sure that people are used to donning and doffing, working very closely with the public health laboratory. And so in this current stage, we've been communicating with them, knowing that the things that we implement here that they can learn from and vice versa. So those collaborations are ongoing.